The American Medical Association. My name is David Graber.
I'm Brittany Neneman.
I'm
McCall
Carter
Surstons.
Argyle.
McCall Surstons.
The AMA is a medical association is the largest association of physicians and both MDs and DOs and medical students in the United States. It was created primarily to help establish consistent teaching throughout all medical schools and to advocate against non-scientific medical practices in the United States that were wildly occurring in the 1850s to early 20th century, such as spiritual healing and Native American homeopathy. The mission of the AMA, it says, our mission is to promote the art and science of medicine and the betterment of public health. Next. Next. It was originally founded in 1847 by a group of physicians who were affiliated with local and state medical associations. At the time, there was no unified oversight of the medical practices in the United States. Nathan Smith Davis is generally credited as being the father or primary founder of the AMA. They met and initially set up their initial charter in 1847 in Philadelphia. These physicians noticed various inconsistencies throughout the medical training through their own states, and they felt that the requirements to become a medical doctor in the United States at the time were not acceptable, and that they needed to be uniform and strictly regulated and to raise the standard. There were schools who deviated from the recommended curriculum and were teaching healing arts, mystic beliefs, and again, like herbal treatments such as homeopathy. Next. From 1847 to 1901, the association was not very effective in reaching their goals that they had initially set out to do. They had very little impact on legislation put forth by Congress, and their local system of just having local charters was largely ineffectual. So in 1901, they threw out their old structure and reinstituted themselves to give them more as a nonprofit corporation, to give them more say and lobbying power on a national scale. They adopted a new constitution to give it a more national character. The current constitution and bylaws establish the objective structures and procedures for conducting their business. And this is the current organization that has persisted and is present in their current organization. Next. The primary body that makes all the decision-making and policy decisions of the AMA is called their House of Delegates. It is a democratic body. It is legislative and the policy-making body. They transact all of the non-financial and non-property oriented business. There are about 550 members. It can grow or be smaller than that, but generally that's the number of members in the body. They meet twice annually to conduct business and appoint other officers to conduct business throughout the course of the year. Below the House of Delegates, they have what are called sections. This is a formal group of physicians or medical students involved in making policy about unique interests related to professional lifestyle practice settings or demographics. There are a large number of different sections, and some of them are resident and fellow, academic physicians, medical students, organized medical staff, young physicians, international medical graduates, minority affairs, senior physicians, and women's physicians. So the general membership will usually fall into one of these sections and voice their issues or concerns that they have as practitioners, and then it will move up to the House of Delegates. General membership is below the sections. This includes any physician who is eligible and has joined the AMA and paid their dues based upon their current employment and educational status. These consist of physicians in residence, medical students second year and above, medical students osteopathic or first year allopathic, and certified physicians awaiting a residency position. Next. On the other side of the way that their structural tree is set up, they have the Board of Trustees, and they are charged with the property and financial affairs of the AMA. The board is composed of 21 members. They perform the duties described by law governing directors of corporations, such as duties prescribed in the bylaws. So this is your standard Board of Trustees that you would find in a typical organization, a corporate organization such as a hospital setting. Below them, they may have an executive committee. They are not always required to have an active executive committee, but one may be in place at a given time. The Board of Trustees appoints three members of this committee at their organization meeting. These members serve until the next board meeting or their successors are elected and qualified. The powers and duties of the committee are appointed by the board. The Speaker of the House of Delegates is allowed to be on this executive committee. Next. Their terminology that they use for their CEO is Executive Vice President. He is charged with the day-to-day administrative activities. He fulfills all the typical activities the CEO does. He ensures that there's an active and effective risk management program in place. He has oversight over the finances and budgets of the AMA, and he appoints committees as necessary. He is also directly responsible for any litigation involving the AMA. Below the Executive Vice President are a series of councils, and they are the Constitution and Bylaws, Medical Education, Medical Services, Science and Public Health, Ethical and Judicial Affairs, Long-Range Planning and Development, and Legislation. These are the management structures that are in place to ensure that their appointed titles kind of let you know what they do. For instance, the Ethical and Judicial Affairs are mostly concerned with ensuring that the AMA is behaving ethically and also deals with their part of their litigation issues, and also is charged with doing research on ethical treatment and practices within the medical field, for instance. Next. The American Medical Association represents doctors, both MDs and DOs, residents, medical students, and patients. Their membership dues for physicians in the AMA, medical students are about $20, retired physicians are $84, active licensed physicians practicing full-time are $420. The AMA is a nonprofit organization, and so a large bulk of its revenue is derived from membership dues. This is a critical source of their funding. Other funding that goes towards the AMA is in the form of grants and contributions to the organization. I'm done.
Okay, so the question, can you hear me? The question is, okay, the question is whether the AMA is a professional organization. So first of all, you'd need to know what a professional organization is. The things that make up a professional organization is that it is a nonprofit organization that seeks to further a particular profession. In this case, it's just talking about public health. and it's in the interest of individuals engaged in that profession of the public interest. So the reason that we do consider the AMA a professional organization is, one, because it's nonprofit, so all of their funds are going towards promoting public health and increasing the general knowledge about health in the public. And its purpose is to engage others in medical research, as well as just to further the public's interest in health itself. Next.
Can you hear me?
Yes.
Yes, you're good.
All right, cool. All right, so the question is whether or not the AMA is an advocacy organization, and as it was previously said earlier, it is. The American Medical Association is a not-for-profit organization which is represented both politically and legally by the American Hospital Association. The AMA strives to be better, strives to better the nation's health and empower physicians.
All right, so the slide I had is talking about the policies that the American Medical Association supports and doesn't support. So one of the first things that I found is that the AMA is strongly in support of the medical liability reform. This is something that was done similar to what has been going on in California, but the medical liability reform will ensure that healthcare is accessible, affordable, and available for patients when they need it. The AMA believes that physicians should not have to worry about potential new causes of action or liability exposure in their attempts to develop new ways to improve the quality and efficiencies of care. Another one that I found, this is some legislative initiatives that the AMA are in support of, but first is the Good Samaritan Health Professionals Act. This legislation protects the healthcare professionals who volunteer during a federally declared disaster from liability exposure. There was a lot of confusion and uncertainty about the application of the Good Samaritan law, so this is something that kind of solidifies and lets physicians know that they're able to help in times of need and crisis without having that liability. And then one of the last ones I found is, this is also a legislative initiative, is the Sports Medicine Licensure Clarity Act. And this bill protects sport medicine professionals by ensuring that they are covered by their liability insurance when traveling with the teams and athletes who they're providing care for in other states. Some of the policies that the AMA don't support, currently right now, I guess a lot of health insurance companies are trying to form mergers with each other. So most recently, Humana and Athena were trying to merge together, but the AMA joined forces with their lawyers and lobbyists, like we'd earlier talked about, and they helped stop that merger. What the president of the AMA, Andrew W. Gurman, said, Athena's strategy to eliminate head-to-head competition with rival Humana posed a clear and present threat to the quality, accessibility, and affordability of healthcare for millions of seniors. There's also been talk that there's other insurance companies that are trying to merge together, and the AMA is working directly, again, with those lobbyists and lawyers to stop those mergers from happening. And the last policy that I found that they aren't in support of is, back in March, the AMA let everyone know that they're opposed to the House of Republicans legislation to replace the federal health care law. They are concerned that the bill would result in millions of Americans losing coverage and benefits. And the last thing I found on that one is that the doctors' main concern are focused on the Republicans' replacement of the subsidies now available to millions of low-income Americans with a flat tax credit for low and middle income people that is adjusted by a person's age. So the AMA emphasized that there needs to be credits that need to be sufficient to enable one to afford quality coverage. And this is something that currently the House of Republicans law or legislation doesn't have, so they're trying to get that taken care of, because the AMA was very much in support of Obama's American Health Care Act back in 2010 when he was in office.